Hello, midwifery friends. My name is Leslie Cornwell, certified nurse midwife with Midwifery Business Consultation. Today, I want to talk to you about consultations. Your initial patient, she's 8 weeks, she's 10 weeks, she could be 28, 30 weeks into her pregnancy. She wants this service. She looked you out. She's here. Her partner, her family is in the room with you, and they don't want this option. They got dragged here today. They don't get midwives. They don't get this mentality that my wife, my daughter, my partner is interested in this type of service, and I want her to be in the hospital with our child. Those consults are sometimes a little tough. You have to go in with a baseline trying to understand. You have to assess not just the mom and her medical risk. You need to assess the support system. You need to assess their driving internal factors of, are there true facts for these fears, or is there some misunderstandings present of what you offer? There's always a breakdown in communication of why this tension is present. You need to find it. Sometimes it's a knowledge deficit. Is the partner next door wants statistics and evidence of your safety, your training, your skills, your thought process, your resources? If that worst case scenario that's fearful in their mind would happen, what is your plan to do about it? Sometimes it's money. Sometimes this woman wants this option and it would cost $3,000 out of pocket, and they're on Medicaid and the hospital will be paid for 100%, and they don't have the money in the partner's eyes to rationalize this choice. So how do you show the partner, the family member, that this is quality and this is a good return on investment for outcomes, decreasing the risk of C-section, improving the breastfeeding rate, the lower risk of depression for the mom? And this is something they'll remember the rest of their life. When someone has a wedding, they're not questioning the cost because it's a once in a lifetime event. So you have to be able to compare and show what are their internal fears or driving forces causing what's happening of fear present. Sometimes it's a personality. Maybe they had a bad experience and trauma with their last care provider and they're just fearful of everyone. You have to create a good trusting relationship, rapport, listening. So many women and families just want to be listened to in personalized care. What are their needs based on their history and situation? And embracing normal. Midwives are trained in physiological birth, and the traditional healthcare system isn't usually set up that way. And what does that look like? What are these benefits that partner support team may not see are present that the mother that made the appointment already sees? So you really have to go back to the basics, listening, understanding psychology, and knowing, okay, this partner, dad is telling me he's got a PhD in research and he's an engineer. I know in my head that he likes numbers and he wants to hear about my past statistics, my outcomes, who I've taken care of so far. What is the objective data to my experience? He's not an art person. He's not literature. He doesn't want the fuzzy, cozy feelings of what this birth will make them feel like. So you have to understand when you're in front of a family, and you may have multiple people in the room with multiple personalities, that you be calm, confident, and don't feel personally offended if you're still not the right choice from them. And that's okay. You're going to have a better business model by just being respectful and kind and helping them get to the right place they need to be. I've had times where she's a vaginal birth after C-section and she would love this option, but she's got some medical conditions. She's got an anterior placenta, and there's true concerns that this isn't the best option for her, and I will help her get what she's looking for, and it may not be directly with my practice. So you just have to look at a consult. It's not just always this person's in front of me and I need to say whatever I can to get them to join me in my practice and be part of my delivery list for a few months down the road. It's what's best for this family. What does she really want from me at this moment in time? Is it social support? Is it medical care? Is it answers that, yes, I can't choose your option of service, but I want somebody that supports women to just give me an unbiased suggestion of choices. I've had a lot of ladies that I just help coordinate them with a great doula, and they have a hospital birth or a repeat C-section, and they join me for postpartum care. I mean, we individualize situations. And so don't get discouraged. Consults are amazing and you can do them. You just have to learn how to ask the right questions and listen to what really is being said. I'm Leslie Cornwell, certified nurse midwife with Midwifery Business Consultation. Thank you.